Hi class, it's Professor Hunt for the last time in this course. I can't believe how quick our learning went for modules 1, 2, 3, and 4. I'm very impressed with all your hard work and dedication throughout this course. So far in this course we learned about the skin, its cells, its functions, and all of its layers. And then we used that anatomy and biology that we learned in Module 1 and took it to Module 2. And we learned about pressure ulcers, stage 1, 2, 3, 4, and the unstageable. And we learned which layers of the skin were affected with each developing pressure ulcer. We learned who's at risk and what we can do to help alleviate pressure and avoid developing a pressure ulcer. Pressure ulcers are painful and they're hard to treat, especially if they get down to the stages 3, 4, and unstageable. Hopefully we can take this information that we learned and apply it to nursing practice. Just know that geriatrics are not the only people at risk for pressure ulcers. Sick children and babies who are fragile are at risk as well for developing pressure ulcers. A lot of time pressure ulcers have the stigma that it's in nursing homes from neglect, but unstable children and babies recovering from post-op or any kind of surgery are just as at risk as geriatrics are. And then in Module 4, we learned about something different that went off track from skin and pressure ulcers, and we saw different kinds of birthmarks. And we learned that birthmarks can be linked to neurologic and genetic syndromes such as Sergio-Weber and gangliosidosis. Very rare, but they do happen. And then we learned about Mongolian spots, how Mongolian spots might be confused with bruising. Just beware that you aren't accusing someone of giving bruises on their child, because depending on their ethnic background, that could just be a Mongolian spot. Mongolian spots sometimes resolve and sometimes they're present through life. Usually they're found on the sacrum, sometimes on the shin, and they are pretty common in the Asian, Native American backgrounds. And then finally, we took all the information that we used in modules 1, 2, and 3, learned module 4, and then applied it to a simulation. Everyone did really well with the simulations. You took my advice and prepared and used that 20 minutes to get all the information that you needed to successfully complete the simulation. We saw that because of our patient's post-op spinal fusion surgery, she developed a stage 1 pressure ulcer on her occiput and sacrum. You all did great with calling the resident and giving a page to the wound ostomy care nurse on how that we can treat the pressure ulcers. You also noted that when the patient desaturated with position changes and poor PO intake, that patient was at risk for developing a pressure ulcer because of her poor nutrition and inability to accept position changes. So everyone did really well with that. Because of this focus was on the skin, sometimes we forgot to note that the patient was in increased pain in the sim because her IV went bad. And we didn't really talk about IVs at all in this course, so that's okay. It's something that I kind of threw in there as a little outlier, but everyone did great, and I'm really happy with how this course went, and I hope everyone learned a lot. And just try to take the the post-course survey so I can improve in the future for other students. Great job, and I hope to see you all around.